Hello, my name is Ifoma. Today I am going to be talking to you about bone marrow aspiration. As a nurse, you're going to be assisting the doctors with bone marrow aspiration. Before a bone marrow aspiration is done, you need to get the consent of the patient, and the patient needs some explanation of and why this is done. So bone marrow aspiration is done because a patient is having problem with the bone marrow, or because a patient has a cancer. So the purpose for us doing it is to check the bone marrow and see if it's working properly, or it can also tell us if the cancer is spreading all over the bone. So the doctor uses this method, this bone marrow, to be able to determine the best treatment for that person. So before a bone marrow aspiration is done, the first thing we need to do is that we need to check the blood lab, draw the lab. We have to do labs like the WBC, which is the white blood cell. We have to do the red blood cell and the platelets. So this bone marrow is taken from the iliac spine, now bone, which is in the hip area. This can be done with local anesthesia or with full sedation. So the patient, so you can use lidocaine to numb that area that the bone marrow will be taken from. And that is just the localized area. So, and when this is done, the patient will be awake. The patient can be awake while this is done. But patient can also be awake, and you give him medications like an anti-anxiety medication, which is another way of doing that. The other way, the third option, is to fully sedate the person, that is, put the patient to sleep before this is done. So if the patient has to be put to sleep, the first thing you need to do, the patient has to be NPO, which is nothing by mouth. And if patient is on a blood thinner, we have to ask the patient to stop taking blood thinner at least for the next 48 hours before this procedure is done. So the preparation is patient has to stop eating, he has to be NPO, he cannot eat anything, and there will not be any, the patient will not be taking any anticoagulant, which is blood thinner. But if the other options are done, like if it's the lidocaine or anti-anxiety medication, this patient can eat for this procedure. After this procedure, the patient can go ahead and start eating if it's been NPO, but it is better for the patient to start with a soft diet, because going with a full diet will aggravate the stomach. So when the nurse's responsibility when it comes to bone marrow aspiration is to be able to inform patients about the plan of what is going on, be able to witness the patient sign the consent, and consent is not to be signed under sedation. It has to be signed before the patient is sedated. The patient is also to check patient record for medical history of allergies, and all that. And as a nurse, you'll be able to answer all the questions that patient will need for you to answer before getting sedated. So when this bone marrow is getting from the patient, the first thing you have to do is to take this bone marrow straight to the lab for it to be read immediately, because we cannot just keep the specimen to avoid contamination or false results. So take the specimen to the lab, put pressure on the patient on the sites, or make sure the sites of the procedure that it has a pressure in there for at least 10 minutes before the patient can go, and make sure he's not to be driving at least in the next 24 hours. There must be a caregiver or somebody to drive him home. Finally, advise the patient to follow up with his primary care physician. So if bone marrow aspiration, the liquid blood marrow will be taken out if it's bone marrow aspiration. But if it's a biopsy, a piece of bone will be taken out. So throughout this procedure, the patient can experience a slight discomfort during the procedure, during the bone marrow, because there's going to be a shift feeling that doesn't last more than 10 seconds. But if the patient requires an extra lidocaine, the patient can receive some extra lidocaine. So that is the end of this lecture. One important thing that I also want to stress out here is that as a nurse in this procedure, before you start every procedure, which every one of you have had millions of times, hand washing, before putting on your gloves, and after your gloves, then hand washing. So for the patient's safety and for your safety. Okay, so just a little summary of what we have discussed today. I am just going to summarize and also throw in some questions in here. We've discussed a bone marrow aspiration. A patient is coming for bone marrow aspiration. What is the first thing you do is that the patient has to be educated on what the procedure that is to be done. Give patient opportunity and time to ask questions. Answer as many questions as you can. Where you do not have the answer, look for somebody to answer the question. Get the answer from somebody for her, because during this period is usually a very difficult time for patients. Most of them are hearing some of the medical terminologies that you are throwing at them. And with the stress of cancer and all the disease or whatever is going on in their life, it's always very difficult for them to process. So give them time to answer questions, give them opportunity to ask questions, and make sure that the bloods are drawn at least 48 hours before the procedure. We will need the WBC, the RBC, and the platelets to be drawn. Then after this is done, make sure the patient will be laying on their stomach or on their side. This iliac is taken from iliac bone. Make sure the pressure is put in, and make sure patient is advised to stop taking their blood thinner, which is we know as the anticoagulants, things like heparin, warfarin, Leavenworth shot, aspirin, Plevex, Eloquas. So make sure patient is advised to stop taking this medication because we don't want them to bleed out from this procedure. Because what does the bone marrow do? It's where the red blood cells are produced. So we don't want this patient to bleed out. So, and I think that is it. Finally, we also ask the patient to delay taking their bath in the next 24 hours. So for almost a day, they will not take their bath. Limit activities for approximately 30 minutes after this procedure. Okay, thank you and wish you everyone luck. Bye.